This skill will demonstrate range of motion. Restorative activities are activities that help residents regain or maintain their ability to care for themselves. The most common restorative programs are range of motion exercises and walking. Range of motion should be performed on joints daily. Range of motion exercises move each body part. This is called range of motion because each joint in the body is moved through its full range. In active range of motion, the resident moves the body part using her own muscle power. In active assisted range of motion exercises, you help the person to move the body part. In passive range of motion, you move the body part of the resident. Your resident's doctor, along with the physical therapist and nurse, design your resident's range of motion exercise program depending on their capabilities and motivation. Ask your supervisor or the therapist if your resident has any restricted joints. As with all skills, follow the common preparation steps.
I'm here to help you do your range of motion exercise, okay?
For your safety and your residents', here are a few tips when you're assisting with range of motion. Maintain a broad base of support by keeping your feet 10 to 12 inches apart. Always bend at your knees and not at your back. Use counting as a way to move in sync with other helpers and your resident. The most common joints that are exercised through range of motion are the shoulder, elbow, wrist, hand, hip, knee, ankle, and foot. Each joint is to be exercised on both the right and left sides. Now for some examples of range of motion exercises.
Okay, now I'm gonna flex your elbow, okay? Okay, if you feel any pain, let me know, okay? You feel anything. You ready?
The first elbow exercises are called flexion and extension. When you are moving a joint, always have one hand above and the other hand below the joint. Generally, the hand above the joint stabilizes the extremity holding it in place. The hand below the joint brings the part through the range of motion. Now turn her palm over, keeping her elbow straight. Then turn her palm back up. This movement is called pronation and supination. Do each exercise 5 to 10 times, depending on the resident's comfort level with each extremity. For wrist flexion and extension, bend her wrist down and then up. Watch the person's facial expressions because they may not always be able to tell you when they are uncomfortable.
5.
Now move her hand toward her little finger and then back toward her thumb. This exercise is called ulnar deviation and radial deviation. Encourage residents also to use their arms and legs throughout the day. If your resident has an exercise program from the therapist, motivate them to do these throughout the day.
Okay.
After each joint is completed on both sides, finish with the common completion steps.